I want to share something with you today that could genuinely save your life. And I'm not being dramatic when I say that. As someone who has spent years working with men's health issues, I've seen far too many cases where early warning signs were ignored, dismissed, or simply never noticed until it was almost too late. We're going to talk about prostate health today, and specifically, those silent warning signs that most men completely miss. This isn't about fear-mongering. This is about empowering you with knowledge that could make all the difference in your quality of life and your longevity. Now, before we dive deep into this crucial topic, I want to ask you something. Have you ever experienced any unusual changes when using the bathroom, especially at night? Maybe you've brushed them off as just getting older or drinking too much water before bed? Drop a comment below and let me know. Your experience might help another viewer realize they're not alone. And that's incredibly powerful. Let me start by being completely honest with you. The prostate is one of those organs that most men don't think about until something goes wrong. It's a small gland, about the size of a walnut, located just below your bladder and in front of your rectum. Its main job is to produce fluid that nourishes and protects sperm. Sounds simple enough, right? But here's what makes this so important. As you age, your prostate naturally grows larger. For some men, this growth is gradual and causes no problems. For others, it can lead to significant issues that affect daily life, relationships, and overall health. The real problem I see in my practice isn't that prostate issues are untreatable. They're actually very manageable when caught early. The problem is that men are incredibly good at ignoring the signs, rationalizing them away, or feeling too embarrassed to talk about them. And I get it. Discussing bathroom habits or sexual function isn't exactly comfortable dinner conversation. But your comfort in avoiding these conversations could literally cost you your health, or even your life. Let me walk you through the warning signs that most men miss, dismiss, or simply don't recognize as related to prostate health. The first and probably most common one is changes in urination patterns. Now, I know what you might be thinking. Everyone's bathroom habits change as they get older, right? Yes and no. There's a difference between normal aging and warning signs you shouldn't ignore. Pay attention if you're getting up multiple times during the night to urinate. I'm not talking about once because you drank a lot of water before bed. I'm talking about 2, 3, or more times every single night. This condition, called nocturia, is often one of the earliest signs that your prostate is enlarging and putting pressure on your urethra. The tube that carries urine from your bladder runs right through the middle of your prostate. So when that gland swells, it literally squeezes this tube and makes it harder for urine to pass through. Here's another sign that's incredibly common but often dismissed. You go to the bathroom and you stand there waiting for the stream to start. It takes longer than it used to. Maybe you have to push or strain a bit to get things going. This hesitancy is a classic sign of prostate issues. Your body is working against that narrowed passageway I just mentioned. Some men tell me they've noticed this for years, but just thought it was normal aging. While some change can be normal, progressive worsening definitely warrants attention. Now let's talk about the stream itself. Have you noticed that your urine stream is weaker than it used to be? Maybe it stops and starts instead of flowing continuously. Or perhaps you've noticed it doesn't project as far as it once did. These changes happen gradually, which is exactly why they're so easy to miss. You don't wake up one morning with a dramatically different stream. It weakens over months or years, and your brain adjusts to each small change. But when you really think back to 5 or 10 years ago, the difference becomes obvious. Here's something that causes a lot of distress but that men rarely talk about. After you finish urinating, you zip up and walk away, only to feel drips or leaks into your underwear. Or you might feel like you haven't completely emptied your bladder even though you just went. This sensation of incomplete emptying is significant. When your prostate restricts urine flow, your bladder has to work harder to push urine out. Over time, the bladder muscle can become less efficient, leaving urine behind even after you've tried to empty it completely. Another warning sign that gets overlooked is urgency. This is when you suddenly feel an overwhelming need to urinate right now, and you're worried you might not make it to the bathroom in time. This isn't the same as having to go when you've been holding it for a while. I'm talking about a sudden, intense urge that seems to come out of nowhere. Some men find themselves planning their entire day around bathroom locations, avoiding long car trips or meetings where they can't easily excuse themselves. That's not normal, and it's not something you should just accept as part of aging. Let me address something that many men find particularly distressing but rarely mention even to their doctors: pain or discomfort during urination or ejaculation. This could be a burning sensation, a feeling of pressure, or actual pain. Sometimes men experience discomfort in the lower abdomen, lower back, or in the area between the scrotum and rectum. This region is called the perineum, and it's where you can actually feel your prostate if you know what you're looking for. Pain in these areas can indicate inflammation of the prostate, called prostatitis, which is different from enlargement but equally important to address. Now I need to talk about something that many men find embarrassing, but that's absolutely crucial to discuss: sexual function changes. An enlarged prostate or prostate inflammation can affect your sexual health in several ways. You might experience erectile difficulties, pain during ejaculation, or blood in your semen. That last one especially tends to terrify men when they notice it. And rightfully so, it's alarming. But while it absolutely needs to be checked out, it's often related to benign prostate conditions rather than cancer. Still, you cannot know without proper medical evaluation, which is exactly why you can't ignore it. Here's a sign that's less common but extremely serious: blood in your urine, called hematuria. If you see pink, red, or cola-colored urine, you need to see a doctor promptly. Don't wait. Don't see if it happens again. Just go. While blood in urine can be caused by infections, kidney stones, or strenuous exercise, it can also be a sign of prostate cancer or bladder cancer. Even if it only happens once and never again, it warrants investigation. Let me take a moment to talk about something that confuses a lot of men: the difference between an enlarged prostate, prostate inflammation, and prostate cancer. An enlarged prostate is called benign prostatic hyperplasia, or BPH. Benign means it's not cancer. This is incredibly common as men age. By age 60, about half of men have BPH. By age 85, it's about 90%. So if you have an enlarged prostate, you're in good company, and it doesn't mean you have cancer. Prostatitis is inflammation or infection of the prostate. This can happen at any age and can be acute, meaning it comes on suddenly, or chronic, meaning it persists over time. It often causes pain and urinary symptoms, and when it's caused by bacteria, it needs antibiotic treatment. Prostate cancer is different from both of these conditions, though it can exist alongside them. Prostate cancer is one of the most common cancers in men, but it's also one of the most survivable when caught early. The challenge is that early-stage prostate cancer usually causes no symptoms at all. That's right, no symptoms. This is exactly why screening is so important and why you can't just wait until you feel something wrong. Now let's talk about risk factors, because understanding your personal risk is part of recognizing whether subtle signs might be more significant than you realize. Age is the biggest risk factor. Prostate cancer is rare in men under 40, but becomes increasingly common after age 50. If you're over 65, your risk is significantly elevated. Family history matters enormously. If your father or brother had prostate cancer, your risk is more than doubled. If multiple family members had it, or if they were diagnosed at a young age, your risk is even higher. Race is also a factor. Black men have the highest risk of prostate cancer of any racial or ethnic group, and they're more likely to develop aggressive forms of the disease at younger ages. If you're a black man, you should start talking to your doctor about prostate screening at age 40, not 50. Let me address some lifestyle factors that might surprise you. Obesity increases your risk of aggressive prostate cancer. A diet high in red meat and high-fat dairy products and low in fruits and vegetables may increase risk. On the flip side, some research suggests that tomatoes, which contain lycopene, and cruciferous vegetables like broccoli and cauliflower might have protective effects. I'm not saying eating broccoli will prevent prostate cancer, but a healthy diet benefits your overall health, including prostate health. Here's something important I want you to understand about screening. The PSA test, which stands for prostate-specific antigen, is a blood test that measures a protein produced by prostate cells. Elevated PSA can indicate prostate cancer, but it can also be elevated due to BPH, prostatitis, or even activities like cycling or sexual activity before the test. This is why PSA screening has been somewhat controversial. It can lead to false positives, unnecessary biopsies, and overtreatment of slow-growing cancers that might never have caused problems. However, and this is crucial, PSA screening has also saved countless lives by catching aggressive cancers early when they're most treatable. The key is having an informed conversation with your doctor about your individual risk factors and making a decision together about whether screening is right for you. For most men, this conversation should happen around age 50. For Black men or men with a family history, it should happen at 40. The digital rectal exam, or DRE, is another screening tool. I know this exam makes many men uncomfortable, but it takes about 10 seconds and allows your doctor to feel the prostate for any irregularities, hard spots, or asymmetry that might indicate cancer. Some cancers don't elevate PSA but can be felt on exam, which is why both tests together provide more complete information than either one alone. Let me talk about what happens if your doctor finds something concerning. First, don't panic. An elevated PSA or an abnormal feeling prostate doesn't automatically mean cancer. Your doctor might want to monitor it, meaning you'll have another PSA test in a few months to see if the level is stable, going up or going down. They might prescribe antibiotics if they suspect prostatitis, or they might recommend a prostate MRI, which is a non-invasive imaging test that can show suspicious areas in detail. If there's significant concern, you might need a prostate biopsy. This involves taking small tissue samples from the prostate using a needle, usually guided by ultrasound or MRI. It's typically done as an outpatient procedure with local anesthesia. Yes, it's uncomfortable, but it's the only way to definitively diagnose prostate cancer. And here's the thing. Most biopsies come back negative or show only benign enlargement. So while the process is anxiety-provoking, remember that the majority of men who have biopsies don't have cancer. If cancer is found, the next step is determining how aggressive it is. Prostate cancers are graded using the Gleason score, which ranges from 6 to 10. Lower scores indicate slower-growing, less aggressive cancers. Higher scores indicate more aggressive disease. Your doctor will also determine the stage, meaning whether the cancer is confined to the prostate or has spread beyond it. Here's something that surprises many men. Not all prostate cancers need immediate treatment. For low-risk, slow-growing cancers, active surveillance is often the recommended approach. This means monitoring the cancer closely with regular PSA tests, exams, and sometimes repeat biopsies, but not actively treating it unless it shows signs of growing or becoming more aggressive. This approach avoids the side effects of treatment for cancers that might never cause problems during a man's lifetime. For higher-risk cancers or for men who prefer active treatment, options include surgery to remove the prostate, radiation therapy, hormone therapy, or combinations of these treatments. The side effects, which can include urinary incontinence, erectile dysfunction, and bowel problems, vary depending on the treatment approach. Modern techniques have significantly reduced these side effects compared to treatments from even 10 or 20 years ago, but they're still possible and need to be part of your decision-making process. Now, let me circle back to those benign conditions, because even though they're not cancer, they still significantly impact quality of life. If you have BPH causing bothersome symptoms, there are excellent treatment options. Lifestyle changes can help. This includes limiting fluids before bedtime, reducing caffeine and alcohol, which can irritate the bladder, and practicing double voiding, which means urinating, waiting a moment, then trying again to empty your bladder more completely. Medications are very effective for BPH. Alpha blockers relax the muscles in the prostate and bladder neck, making it easier to urinate. They work quickly, often within days. 5-alpha reductase inhibitors actually shrink the prostate over time by blocking hormones that cause growth. These take longer to work, sometimes several months, but they can significantly reduce prostate size. Sometimes both types are used together for better results. For men who don't respond well to medications or who have severe symptoms, there are minimally invasive procedures. These range from techniques that use heat, steam, or laser energy to remove excess prostate tissue, to more traditional surgical approaches. Your urologist can help you understand which approach might be best for your particular situation. Let me address prostatitis briefly because it's often overlooked. Acute bacterial prostatitis comes on suddenly and makes you feel terrible. Fever, chills, body aches, painful urination, and sometimes an inability to urinate at all. This is a medical emergency requiring immediate antibiotics. Chronic prostatitis can be bacterial or non-bacterial and is much trickier to treat. It causes ongoing pelvic pain and urinary symptoms that can be incredibly frustrating. Treatment might include long courses of antibiotics, alpha blockers, anti-inflammatory medications, physical therapy focused on the pelvic floor muscles, and stress management techniques. I want to spend a moment talking about the emotional and psychological impact of prostate problems, because this is real and significant, but rarely discussed. Many men feel embarrassed about urinary symptoms. They avoid social situations, stop traveling, or withdraw from activities they love because they're worried about needing the bathroom urgently. Sexual difficulties can strain relationships and affect self-esteem. Fear about cancer can be consuming, leading to anxiety and depression. If you're experiencing any of this, please know that you're not alone, and these feelings are completely valid. Talk to your doctor not just about your physical symptoms, but about how they're affecting your life and mental health. There are resources, support groups, and counseling services specifically for men dealing with prostate issues. Your well-being encompasses your physical, emotional, and social health, and all of it matters. Here's what I really want you to take away from this conversation. Your prostate health matters, and paying attention to warning signs can make an enormous difference in outcomes. Don't dismiss symptoms as just part of getting older. Don't be embarrassed to talk to your doctor about urinary, sexual, or pelvic symptoms. Don't skip screening discussions because you're worried about what might be found. Start having conversations with your doctor about prostate health in your 40s or 50s, depending on your risk factors. If you're noticing any of the warning signs we discussed, getting up frequently at night, weak stream, urgency, pain, blood in urine or semen, don't wait. Make an appointment. If you have risk factors like family history or if you're a Black man, be extra vigilant and proactive about screening. Take care of your overall health. Maintain a healthy weight. Eat plenty of fruits and vegetables. Stay physically active. These habits benefit your prostate and your entire body. If you're diagnosed with a prostate condition, whether it's BPH, prostatitis, or cancer, educate yourself about your options. Ask questions. Get second opinions if you're uncertain. Make decisions that align with your values and goals, not just what someone else thinks you should do. Your health is worth the discomfort of awkward conversations. It's worth taking time for medical appointments. It's worth advocating for yourself when something doesn't feel right. You deserve to live without the burden of untreated symptoms affecting your daily life. You deserve the peace of mind that comes from knowing you're taking proactive steps to protect your health. I hope this information has empowered you rather than frightened you. Knowledge truly is power when it comes to health. The men who do best with prostate issues are the ones who catch problems early, who communicate openly with their healthcare providers, and who take an active role in their care. That can be you. If you found this video helpful, please share it with the men in your life, your father, your brothers, your friends. This information could genuinely make a difference for someone you care about. And remember that comment I asked for at the beginning? Go ahead and share your thoughts or experiences below. Building a community where men can talk openly about health challenges helps break down the stigma and isolation that too many men experience. Thank you for watching, and please take good care of yourself. Your health matters, and so do you.